People present with these symptoms because at the foundation of all things COVID is inflammation. And I think the struggle for a lot of people is that there are different mechanisms of injury and pathology associated with the spike protein. And the question is, what is the main driver for your symptoms? So is it just simply inflammation for you? Or is it autoimmunity? Individuals with postural orthostatic tachycardia syndrome have had several autoantibodies identified that are impacting the autonomic nervous system. And that would be the big driver of their symptoms. Getting rid of those autoantibodies is very difficult and oftentimes requires expensive treatment such as IVIG or something called plasmapheresis, where it's kind of like a filter of the blood. But these treatments are expensive, they have to be repeated, and the improvement can be temporary. So that may be one of the drivers for an individual who presents with long COVID. Another one could potentially be vascular issues. So the spike protein attacks the capillaries, the baby capillaries that send blood with oxygen and nutrition to every cell in the body and ultimately to the mitochondria. The mitochondria is what produces energy. So if you have problems with the capillaries getting oxygen and nutrition to the mitochondria, then it's very difficult for you to do what you need to do. And you can see how if the brain doesn't work, if it's not getting oxygen and nutrition, or how the muscles would be very fatigued and really would have a hard time recovering. The other thing that people will present with is problems with microclotting. So if you already have problems with your vessels and inflammation, but then on top of that, just the spike protein being put in the blood alone can cause a clot. In addition to that, it initiates what's called abnormal amyloid protein formation, meaning that it creates abnormal amyloid fibrin clots that are very difficult for the body to break down on its own. And now you have clotting on top of that. The immune system is impacted by the spike protein. There's immune dysregulation, almost like people can have immunosuppression. So some viruses that have normally been dormant in their body and that have not caused a problem, but then once they get COVID and have this immune dysregulation, then these viruses can be reactivated and people can have chronic symptoms associated with the reactivation of these viruses.